If you're pre-diabetic or just curious about blood sugar, let's talk about the HbA1c. Here we have two blood vessels. The dots represent glucose floating around in the bloodstream. The top shows normal blood sugar and the bottom shows elevated blood sugar with much more glucose. As red blood cells move through, glucose can stick to hemoglobin, which is the protein in our red blood cells that carries oxygen to the rest of the body. So, when our blood sugar is high, there's a greater chance that more glucose will stick to the hemoglobin, forming what's called glycated hemoglobin. If this hot dog represents a red blood cell, think of glucose like honey. Too much glucose can bind to the red blood cell, just like honey sticks to the surface. While this is just a metaphor and it doesn't actually make the red blood cell sticky, too much glucose can impair how well red blood cells move and how they carry oxygen. So that's where the HbA1c test comes in. It tells me how much glucose has been sticking to the hemoglobin in our red blood cells over the past 3 to 4 months. Think of it like a report card for blood sugar. According to the American Diabetes Association, below 5.7% is considered normal, between 5.7 and 6.5% is prediabetes, and anything above 6.5% indicates diabetes. All of this is important because when blood sugar is too high, it can lead to serious health issues. By knowing our HbA1c levels, we can catch problems early, and that's key to managing our health and preventing complications.